Hi guys, it's Natalie Zangon. Hope everyone is doing fine. This is another video of mine for studying for the MFT Clinical exam made simple. However, you could make this simple. So I had promised some colleagues of mine that I would do like an overview and a study with the DSM for tonight. So some things that I wanted to share is that the main diagnosis for the DSM that are like the head diagnosis that we have to get comfortable and remember are the anxiety disorders. Then you have the psychotic disorders, and then you have the depression group, and then bipolar. So one thing that you need to know is that with mental illnesses, it's like a stages. It has stages. It's not that you have a cold or you don't. It's like a gradual progress based on how long you've had the symptom. The name can change based on the duration that you had the symptom. For instance, within the anxiety disorder family, for acute stress disorder, it's anywhere from 3 days to 1 month. So acute stress disorder, the symptomology is there from 3 days to 1 month. For PTSD, it falls from 1 month to 3 months. For unspecified anxiety disorder, so that means that it's not so much that it would fit under general anxiety disorder. It's more, it's unspecified, it's not detailed. The disorders has to be present anywhere from 3 months to 6 months. Also, adjustment disorder falls under that category from 3 months to 6 months. And separation anxiety for children, it has to be present for at least 4 weeks. Okay. Then we go to our psychotic family. Psychotic that are having a lot of delusion, hallucination, imagination, and all that fun stuff. So with the memory stuff, with the brief psychotic, it's like a lot of audio things happening with the mind and hearing things and believing things and the delusion and all of that. So brief psychotic disorder. The brief psychotic disorder is anywhere from 1 day to a month. So in order for the client to get the diagnosis of brief psychotic disorder, it's anywhere from 1 day to 1 month. And we had a discussion, I don't remember that. Okay, so for schizophrenic form is from 1 month to 6 months. So the timeline for schizophrenic form is 1 month to 6 months. Then if the patient has the symptomology for 6 months and above, it becomes schizophrenia. For 6 months and above, it becomes schizophrenia. Then we go to the depression family. So major depressed, they have to have the symptoms of persistent depression for 2 weeks. So persistent depression symptoms for at least 2 weeks to qualify for major depressive disorder. Major depressive disorder, you have to have the symptoms for at least 2 weeks for major depressive disorder. And then, so to have the persistent depression, you have to have it 1 year for a child and 2 years for an adult. So persistent depression disorder, it's 1 year for a child. The symptoms have to be present for 1 year, and for an adult, 2 years. Disruptive mood disorder has to be present for 1 year. Disruptive mood disorder. Then you have the bipolar. Bipolar, you should think of the up and then the down. So the mood has for bipolar one is the enormous one. So where the client has the full manic energy, doing this risky behavior, buying, gambling, no limits, no consideration of these things. They have the full manic for at least 1 month. And then, So it's like it's like a full-on manic for a whole 1 month. And then bipolar 2, it's 4 days of hypomania, followed by depressive disorder. But the depressive disorder is not severe enough to impair their life. So the bipolar one is a lot more severe because you have that full-on manic for 1 whole month, at least 1 whole month. And then also wanted to go over, so with the neurodevelopmental disorder, under that you have the intellectual disability, communication disorder, autism spectrum, and there is no more Asperger in DSM-5, it's only autism spectrum. Then you have the attention deficit hyperactive disorder, specific learning disorder, motor disorder, stereotypic movement disorder, tic disorder, and other neurodevelopmental disorder. So one thing I wanted to mention is, hold on a second. Okay, so this is also an extremely useful little booklet to get. It's called the DSM-5 overview. It has like the overview of all the different diagnoses. One thing I wanted to mention is like we were saying, hypomanic is similar to manic episode, but the period is at least 4 consecutive days. Whereas for the full manic, it's at least 1 whole week, or irritable lasting at least for 1 whole week at least. And can even go like up to presence of at least 3 of the following. Yeah, so for bipolar 1, it's 1 whole week of the manic state. So major depressive indicated the presence of at least 5 of the following during the sustained 2-week period: persistent negative mood, diminished satisfaction or pleasure from engaging in nearly daily activity.